You're all welcome. Hello, everyone. Once again, how are you doing today? It's a very, very warm day here. Today is the 31st of October, 2025, and we have a very interesting topic to discuss. Today's topic is going to be something that would live with you when you come here in the US. It's going to live with you. What I mean is that it's going to be a life that you will live, okay? There's nothing you will do in the United States without your good knowledge of EMR. Okay, so what we are going to be discussing is very important. It's not something that you can push away. It's not something that you can, say, okay, don't worry. Whenever I get there, I'll learn it. For sure, you will learn it when you come here, but it's always good. If I had this opportunity before I came to the United States, I would take it because this is one of the anxieties that a lot of people who are back home are having. How am I going to do the charting, the documentation, something I'm not used to in my home country? How am I going to do all that? How am I going to survive? This is not something that I'm usually, supposed to do if I were to be in my country. So this is something that I want us to pay close attention to. Okay, so you are all welcome to today's program. My name is Decency NCLEX, the vendor of good news, and today we have a very interesting person in our midst. She is, how will I start introducing? She's wearing a lot of hats, so I don't know which hat to start with. So, but first, let me start with the unknown to the unknown. Okay, let me start from the known to the unknown. So. Cynthia Michael, Cynthia Arundu is a registered nurse here in the United States. She has been here for close to 5 years. She's been a registered nurse for close to, I think, almost more than, I think, going to two
15,
decades. Yeah? Yeah?
15
15
years.
years, okay. So she's been a registered nurse for 15 years, okay. So, but all together, she's been here in the United States. She's been doing awesomely, wonderfully well for herself. She lives in the state of Indiana, right? I'm getting it right. I don't
Yeah,
want to, huh?
yes.
So she lives in Indiana, and I think something is echoing somewhere.
Yeah, someone's mic is turned on, and that person is Cindy. Yeah, we're good now.
All right, so Cynthia is residing in Indiana, and she is a registered nurse, like I said. She's also an adjunct lecturer in an university there, so she's also lecturing. But today we are going to be doing more of who she is to us. So Cynthia is one of our own. She did her NCLEX with Decency NCLEX Academy. She passed on one sitting, and she became an assistant director of education with us in Decency NCLEX Academy. So she went from being an assistant director of education to being the director of education for many years. So she was with us for a very long time. So before she came into the United States and became so busy, and then our small money cannot pay her again. So so we cannot pay her for her services. So she decided to step
No,
away for a little bit, but she's still
no.
part of us. Cynthia is still part of us. She's still a member. Once a member is always a member. So the DNA blood is in her. So when we
No.
reached out to her for her to come here today and give us a talk on EMI,
Yeah.
she said absolutely yes. She did not give me trouble. She did not tell me, let me check my calendar. She said, when do you want me to come? And that's the spirit I want all of you to have. When you come to the United States, one day you're going to see me on your page reaching out to you for you to come and give back to this community here. And when I do that, I want you to not give me trouble. Just tell me, okay, which day do you want? Just like Cynthia. So, Cynthia, you're welcome to the program. How are you doing today?
I'm fine. Thank you so much, Buzzy. Thank you. Thank you so much. Thank you so much. It's
Already.
been
How is
an
it in
amazing
Indiana?
time. Currently the weather is not so good. It's windy.
Mhm,
And in a way, I wish I could travel again around.
mhm,
But so far, I think I'm trying to settle in here. I'm trying to
mhm,
settle in compared to other states that I've been in. first as a travel nurse, which I think the cost of living is good. The weather, it was okay when I started, but this year I don't know what the weather
Just come
predictions
to
are all about.
Virginia. Just come to Virginia.
You've
Virginia
got
is
to.
the
I've
best
gone to
place.
Virginia twice. I
I
saw that
know. Just come and
summer,
live
two
here. Come,
holidays
let's buy
in
a house for
Virginia.
you in Virginia.
You guys will give me money.
All right. Okay, Cynthia, we are just going to go into the program. I want you to
Okay.
share with the house. People that are here are people who have written their NCLEX, people who are on the journey, they're trying to write their NCLEX. Majority of the people who are here are held back because of retrogression. I know you have a unique story during your own time that,
Yeah.
affected you a little bit. I remember when
Yes.
you would always reach out to me and be like, Boss D, this thing is too much. I was like, don't worry,
Yes.
don't worry. One day you'll be here.
Yes.
See you here now and shining. And that's how it's going to be for most of you. A lot of you are reaching out and saying, oh, Boss D, what's going on? This retrogression, can you just predict? I don't do prediction. You understand? Just don't worry. It's going to come when it will come and you'll be okay. You understand? So everybody have their own story, but I will let Cynthia tell you her journey to the United States. It's a unique journey actually. So just listen as she does introduction. I may have not done your introduction very well. I know you wear a lot of hats. So she is a registered nurse, okay, USRN, okay. She's also a registered midwife. She's also MSN. She has an MSN, and then she's also a nurse informaticist. So if you guys that are looking into going into nursing informatics, she's also one of the persons that you can go to in that kind of area. She did it and she did it really good. So I know some people do some courses and they don't really know what they can't defend those courses when they come out. But she did it and she did it really good. And she's one of the persons that you can reach out to if you want to, get groomed in that area of nursing informatics. So Cynthia, do your introduction the way you want and tell us your story about your journey to the United.
Uh,
Mhm.
all right. Hello everyone. But they already said everything. My name is Cynthia. I've been a nurse for like I think November 4th will be 15 years. Yes, 15 years. And it's been quite a journey. I stumbled on Decency Academy when I wanted to write my NCLEX exam. Then we were just starting up, and I got useful tips. In fact, I would say one of my weakest points during the preparation was psychiatry and pharmacology. I was good every other like with every other concept, every other topics and all of that, but with psychiatry and pharmacology, they were not my strongest points. And I know then Bosti was still in Nigeria and he would be like, Cynthia, do this, Cynthia, do that. And I kind of leaned on God for a better way, strategy to go about it. And lo and behold, I will share that part of the story soon. So prepping for NCLEX, it was also quite a journey. I did meet interesting people. One of them, I think he's been on this platform, Dr. Chimdi, and Nonye Madu, Aloysius Okay, I think I saw some of their clips too. And they were instrumental to guiding and all of that. To the exam itself, it was it was not what I expected. Like I said earlier, my weakest points were psychiatry and pharmacology, and that was actually what I saw in my exam from beginning to the end. Well, a bit of cardiovascular and all of that, but they were primarily psychiatry and pharmacology, and I was grateful that I got to tidy up that area before the exam. Post exam, I was already with an agency, so we started the whole process. And then came the retrogression. And after retrogression, then we had an issue, and then the first ban on Nigeria. I think that was in 2020, the height of COVID. I think it was just a national measure to control the spread of the COVID-19 virus disease and all of that. So we had to spend one more year, and then later on, when Biden got in and then the COVID was better, then we're all let in. So for anyone who is waiting behind, don't give up. I know I was feeling so down, but the good thing is I kept building on myself. I kept I was getting myself ready for the work ahead, mentally, physically, professionally, and otherwise I was getting myself ready for the job I was gonna come to and all of that. So that's it. Professionally here in the US, first I started as a registered nurse midwife back in Nigeria, got my US license, became a USRN. Immediately I came in, I started my BSN program. For one thing, I never wanted to do my BSN in Nigeria. I wanted to have a foreign touch to my story.
Career.
So immediately I came in, like I think 2, 3 months I came in, I got into school and I did that. I did my BSN, and after my BSN, the school reached out to me. The university counselor reached out to me, and she's like, "Oh, Cynthia, you actually kept a very high grade. I think a 4 point GP." And she's like, we're going to offer you some discount if you would start your MSN program." And then I started my MSN program because I got that discount. And I finished also with almost a 4 point GP too. And here we are.
Wow, wow, wow. See, guys, it's always gonna end on the sweet side. So
Yeah.
don't worry about what's going on now. Don't worry about the retrogression. Just develop yourself. One thing that I take home from what Cynthia said is that during that time that there was retrogression, there was ban, and at a point, I think it was also like an administrative processing from the
Yes.
agency.
And
See, I remember
embassy,
your story more
they
than
had
you.
a lot of, yes, they went back and forth, like provide more evidence
Yeah,
and all
yeah,
of
yeah.
that. I also had the problems when I was filing my I-140. I think I got the first denial, and I was
Mhm.
like, what's going on? Tell me. Oh."
Mhm. See,
And then by the
see.
second one, I had to just go back and pray, like, no, 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 and all
So-
of that.
Somebody in the comment section say
Oh,
you were her
okay,
teacher in
2019.
DNA in 2019. So you see, your products are here. So Cynthia actually gave in her best when she was with us in the DNA. So she was a one-on-one instructor. She was always she's one of our go-to person when you come to drill. If you want to drill somebody
Yeah.
or drill sessions,
Most
okay,
people,
so
they
go
didn't
to
like me for
Cynthia.
the drill. Nobody likes
Midnight
me when it
drill.
comes to the drill. But
Yeah.
that's why I come in. Like you're coming into a space where you don't know. I would say you don't know anything. One of the things I tell people, and that's what helped me, even though I was a nurse back home in Nigeria, I took off that and that mindset. I unlearned that. I wanted to learn what's this Western nursing all about, and I think that helped me to get into the system. Even when I got in, like I just adapted immediately. I just started seeing myself. If I have this colleague and this colleague, if I'm met with this condition and all of that, if I'm meant to critically think and all of that, so it just kind of like help boosted everything.
Okay, that's good. And just for me to put it out there, if you are looking for something to be doing while waiting for retrogression, we have some vacancies in DNA. So you can consider going to our email and reaching out to us. You might be one of our Cynthias in the coming years. Okay.
Uh, no, seriously, I did leave a lot of Cynthias that became bosses. They
Yeah.
became other bosses and other bosses and what they called me then, they called me grandma,
Ancestor.
grandma. Like I
Yeah.
had lots of grandchildren
Yeah.
afterwards. Yeah,
Yeah, one of our goal in DNA is if you want to really be a seasoned instructor in DNA, you must produce at least 5 NCLEX passers. So that's
passers.
that's when we call you like a seasoned instructor. We can trust your format of teaching. So once we come, we give you some people that you're going to be coaching, and then We are going to coach you first. We're going to give you all the materials, then we'll give you people that you will coach. Once 5 people pass under you, don't worry, you will just start seeing yourself going far. People will be, calling you. People will come and requesting for Cynthia. Cynthia must be my instructor. I say, no, Cynthia is filled up. We need to assign you to more people.
You know
But
the
it's all
funny part,
good.
I just remembered something. The first day I came into the country, I think I left on a Sunday and I arrived on a Monday. My first Sunday in the US, I was in church and somebody walked up to me and she
Mm.
was like, don't I remember her? I was looking at her like, I am just Johnny Just Come. I'm not even whatever. The only time I think people must have seen me would be like midweek service. Like I arrived on Monday. On Wednesday, I already identified the church and went for midweek. And not much people were there, unless maybe people connected on Zoom. And then on Sunday is the first time you're seeing me, and then you're walking on. And then she started describing and describing. And I just put my hand on my head. I was like, Jesus. And she was like, no, 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 no. I'm like, okay, did you pass? She said, yes. That this stuff, I lost. That is, if I didn't even remember the story until she started telling me. Then I could recollect who she was because she had a particular story and all of that. So it was actually another wonderful moment too.
Yeah.
I
Yeah.
see a lot
So
of comments and everybody is saying something about Cynthia here, Cynthia there.
that's to tell you how well we appreciate you. Okay, let's dive deeper into our topic today. So, Cynthia, a lot
Yeah,
of people are having anxiety about computer documentation. How are they going to cope? Especially most of us that are like elderly. First of all, I'm just going to ask you one yes or no question. Do you think that an elderly person, maybe 50, 60 years, can actually come to the United States and cope with the documentations, in the US?
absolutely.
Okay, now.
Absolutely, yes. If you can pass the NCLEX exam, you can actually, because the NCLEX exam requires you using a computer.
Mhm.
There's no two ways about it. You have to use a computer. You have to log in. You have to click here and click there. You have to all of that, put in your login and all of that. So if you can actually pass your NCLEX exam, no matter the age, your age, if you're 50 or 60 or whatever, you can definitely move in. It's easy for you to adapt. No need to be scared.
Okay, that's a good one. And also, I would like you to, just give us, before we go into the EMR, can you give us like, I know you work in the hospital, in a hospital facility. Can you give us from the time that you clock in to the time that you clock out? What are your activities as a registered nurse here in the United States? We just want to get to know you better before we now go to the EMR.
Okay. So my normal day, like today, I think I'm gonna starting my night shift. First thing is um I never start my day without a form of prayer. So by the time I'm getting to clock in, I must have said a prayer, clock in, and then I go check the assignment board. This can be different with each hospital, but for my current hospital, I have to go look at the assignment board. I see what floor and what rooms that I have to take. The hospital I work in, well, good enough, it's one nurse to four patients. So it's pretty much not so heavy, but can be heavy depending. And then I get to the floor, get my table set up, wipe down, because you don't want to take some things home, and then get report. And when I get reports, I I kind of do a few things, and it's peculiar to me. Back then, when we're prepping for nursing, we did prioritization and delegation with La Charity when we're preparing for the NCLEX. So I imbibe that culture too when I'm taking reports. I'm prioritizing what the out of the four patients you're giving me reports. I'm asking pertinent questions, but I'm prioritizing which patients I need to see first and which patient I need to see last. For instance, if I have a patient who is on the heart monitor and is having a crazy reading or is on a drip and all of that, I think that person will be my first person than someone who has dementia. You get it, because at that point it is we remember our ABCs, it's part of the cardiovascular, the circulation and all of that. And the person is already having a biorhythm. I want to make sure that I have a baseline of what the person was when I start my shift. And then it kind of helps me to um plan what my next activity will be, and also help me to revert back. If this patient changes condition at any time, I'll be able to tell the doctors like, hey, I met this patient like this. I think something is going wrong, or something is off, or something like that. So I'll be able to make that. So I try to prioritize what patients I get to see first. Then when I'm getting the report, another mental thing that I do is I know what's the reason why this person is here, the primary diagnosis. And then it helps me ask certain questions. Say, for instance, this patient came in with a respiratory problems. I want to know, is this patient on oxygen? If yes, how many liters? Is there a humidifier? How has it been throughout your shift? And the last shift you took report from, did they say anything? So that way I'm able to note if I should prepare for the worst. For instance, if the patient had in the previous night, the patient always desaturates while they are sleeping, it preps me up as a night shift nurse to know that this patient desaturates when they are sleeping, and it's not going to be a cause for so much worry. It's just going to make me monitor the patient more closely. So I do kind of focused interrogation kind of with this nurse, just to get that information. When I'm done, and we do bedside reporting, so I'm getting to the patient's room, I'm talking with the patient, I'm introducing myself to the patient and all of that. I'm taking cognizance of the environment as well, because sometimes, especially when you have patients who have some kind of psych issues, you want to make sure that they are safe. For instance, if they're there for suicide, you want to make sure you don't have anything sharp or something that the previous nurse must have overlooked, and all of that. And then I leave. Next thing, I go to the patient's chart. This is where I log into the computer again. And then I read through the notes, see what the doctors have said for that shift, and then see what the plan is, see the vital signs trend, um, and try to make my to-do list for the shift. Next is vital signs. And I start with the person who, like I told you, I already prioritized first, so that I'm able to know this is what I'm working with. And this person is less not important, or something like that. And then I move from there, phytoscience, do my assessment. Now, there are two kinds of assessment. You have the general assessment, and then you have the focused assessment, and all of that. And mm, for the general is head to toe. You want to check skin, you want to do that. But the focus is basically on the system that is being affected. If the patient is there for respiratory, I want to listen to your lung sounds. I want to make sure that there is nothing new, or you're still on the same level. If you're a cardiovascular or stroke patient, I want to make sure that it's not worse, or that, okay, I have a basic stroke skill, that this is what I've assessed you to be. If anything goes up higher than that, then I'm reaching out to the doctors and all of that. So I do the general and the focused. I run through the medication list, and then it's time for medication. Medication time, I'm looking at your allergies. And then when I'm talking to you, I need to confirm. Normally, you use two patient identifier, patient's name and date of birth. You ask this patient, what's your name, and then date of birth, and all of that. For some patients who are confused, most of them actually tell you what their names are, and then the other, sometimes they might not accurately tell you what their date of birth is, and they have this armband on their hand, so you're able to scan through just to make sure that you're giving this patient the right drug and all of that. When we're done with that, then we chart all the assessment and all our findings, and then it's 2 hourly rounding until midnight. Midnight, another set of vitals, in the 2 hourly period, you're asking patient if they need anything. You're making sure they're in the right position. For patients who need 2 hourly turning, you're doing that. Patients who are incontinent, you're making sure that they are clean, they are dry, they are not soiled. And you're just trying to make sure this patient is in a much comfortable position or in a comfortable state. And then from before midnight it's hourly, then from midnight to 2 hourly because you want to also give them time to sleep and rest. The next 4 hours, you're doing another set of vitals. You're taking labs, you're checking if there's any deviation from the previous one, and seeing if there are any critical values to report and all of that. Now, while you're doing all your vital signs and between midnight and the next 4 hours, you're comparing that with your previous vitals to make sure that there's nothing abnormal. Say, for instance, the first vitals you got a normal vitals, and then by the second time, you're getting a very low vitals. You reassess and you reassess. You ask this patient question like, you dizzy, any palpitations, all of that questions. And then you now check again, you check extremities, almost all 4 point extremities, and you're finding same thing. Then it's a cause for alarm. Then you report and say, oh, to the doctors, like, I think something's going off. This was what I got when I started, but this is what I'm getting, and I've checked all around. And then they can come in and reassess this patient. And then by the morning, I have another nurse coming. I already have my reports ready, what really happened, and I'm going to highlight on the very important things that really happened in my shift so that the nurse is well, like prepared. Like I mentioned, if the patient had a very low blood pressure and I gave fluids, that's one of the things I want to report during my reports. Like, tell this nurse, this is what happened and this is what we did, and then they can also be aware, very, very much prepared for their day. And then it's clock out and bye bye.
Okay, good, good, good. So that's it in a nutshell. So which area of the hospital do you work? Is it massage or?
So, so I used to do float pool, so you can send me anywhere, but please don't
Oh
send me
my
to the
God,
ICU.
that is
Yes,
super
I
user. You
work.
can work anywhere.
Yes, I work almost all units. I work burn unit. I worked burn. I work outpatient. Now this is day. So for me, I do day and night. And I think I got my doing the oncology during the day was as a result of something that happened before. And I kind of loved it. And I'm still doing that now. So I do outpatient chemo and chemotherapy, immunotherapy. I work also in the I that step down from ICU, short stay for people who come out from surgery and maybe they're not going, and PACU is closing up. Well, I take care of you. And then on my main floor right now, I work in a floor that's called acuity adaptable. You have the patients there, they have different acuity levels. So it's kind of like your med surge, but I would say it's a glorified med surge because we also give some kind of drips like the amiodarone for people with heart conditions. But then when they are going down like the levofed or something that needs continuous monitoring, then we send them, like we
Interesting.
escalate up. Yes, we do that. And it's just in between there.
Wow.
Yeah.
A lot of people on the comment section saying they are coming to Indiana. Why can't you guys come to Virginia? What's wrong?
So the
No, it's
thing
not
is
allowed in
this.
this program for you to come to
No,
my
please,
program and take
please,
away
please,
my nurses.
please,
No,
please, please,
no,
please,
no, no,
come,
no,
come,
no.
come, come.
We
The thing
cannot do that.
is, no, this is it. This is this. I think I've been to 4 states in the US, and I kind of settled here. I've not been to some other states, like literally like lived for like 6 months in other states
Mm,
that I've been to. They were just like casual states. But I've lived in about 4 states in the US, and I would say that Indiana has their cost of living is much, much like effective. You have a Nigerian community too.
mm.
When I
We
was in
have
Kansas,
Nigerian community too. We have African
The
community.
Yorubas, we appreciate Indiana, so I give it to them. We also have the Igbos too. Like
We have
I think a few weeks
African.
a few weeks ago, we had the Igbo community and all of that. We also have the Muslims too, and all of that. Yes, there's a mosque somewhere. I think I passed that one time too. I love to explore my area, so I think I saw
So
a mosque. I'm like,
you're
the
just
mosque.
advertising Indiana in my
Oh
program.
well.
You cannot do that. So now let me tell you people one thing that she doesn't know. She doesn't
It
know
has
that
some.
it's not just Nigerians that I have on my program. I have a lot of people from Kenya, from Ghana. I think it's only Nigerians that are here.
Him. Yeah,
Yeah,
yes,
we
we
have
have
a lot of people.
Ghanaians
So we
here
have
too.
African
In
community
fact, two
in
of
my
my
own group.
guys, two of my they're my friends, they are ladies, they are much, much matured women. They are, I call them my guys. You know this who's my guy. That's how it came about. One of them was actually my preceptor when I joined the hospital I currently work in. And she gave me a soft landing and all of that. So I kind of called her my guy. And you have Kenyans, you have Ghanaians, you have all of them. We had a sister group where we all meet, like it's all
Please,
Africans,
Cynthia, let's go back to our
Zimbabweans,
program.
South Africans,
Please stop taking my losses. Let's
Liberia,
go to our program.
Togo ladies, Niger. There's another Sierra Leone guy, Senegalese. I have two friends, Lika and Awa. They are good. They currently live around me. They are Senegalese and all of that. So it's a much, much diverse place and all of
Hmm.
that. But the thing I kind of like look around, I looked around when I decided to, okay, let me stay here and see how it's going to be. I may move, who knows?
You
Maybe I
come
might
to
come to
Virginia.
Virginia. But the thing there is, I looked at one, the cost of living. Then I looked at the weather. Um, um,
But the
Kansas
weather in
was.
Indiana is not so great. Oh, you guys have snow. You pack snows. I've
We
never packed snow in my house.
the funny thing
I
is
see
that
snow, but I don't
if
pack it.
from
Before I
I
come
had
out,
to
it will
look.
melt.
No, I had to look at like over the years, how has it been? We don't get snow like the first time I came in here, we didn't get snow like till February. And it just lasted for just February and then we're gone. I think it
At
only felt
least you
like twice.
got.
And I
At
was
least
looking
you
at
got.
myself and like, this is better than Kansas. Like
Mm.
Kansas, like
Someone is
my
going to
feet was
Kansas here. Oh.
I was digging into the snow in Kansas.
I
Like
have someone in the comment
I'll
section
look
that
at my
said
car and I'll be
Kansas.
like, Jesus, how do I drive with this car? And I'll start scraping my car before I could drive it, or I'll heat up my car for 30 minutes before I will enter inside.
Mm,
And then apart from that, Kansas was a whole lot. I think Kansas, their terrain, it was just like plain ground. So everything is just on them. If it's sunny, it's hot. If it's windy,
mm,
it's hitting you. If it's snowing,
mm,
it's just everything. And
mm.
again, in Kansas, I had a not so good experience. I had bullying at the workplace. Yes,
Wow.
I
Tell
don't
us
think I've
about
shared
it.
this anywhere.
No,
It
tell us
was
about it.
not
We'd like to hear such story.
so. It was I was
Rahila,
on
don't
an
be scared,
assignment.
please. Don't be
No,
scared. You
don't
might
be
be going to the
scared. The
good
thing
part
is,
of
you just need to know what
Kansas.
to do. Yeah.
Mm,
So I worked in this hospital. I had very good managers and all of that, but then the bullying was from the colleagues. And this was during that COVID period. They would send, I was there with another colleague, Joy. We were the only two blacks in the hospital, and we were the only two blacks in the entire community. Like we are going to the shopping mall or something, we're the only two blacks. And the area where we were, the closest Walmart was a 45-minute drive.
mm.
They had other mini stores, but Walmart gives you like
Multiple
variety and
choices.
also
Mm,
cheaper prices. And then you're also
mhm,
looking at tax, the ones that they don't give take tax, like food taxes and all of that.
mm.
Those are ways you can also save money too. So Kansas was that kind of environment. But at the workplace, I they would send us to COVID rooms, and they would not go themselves. And then at some point, I was like, "What? Why is it always two of us getting into COVID rooms?" And one of them said that there is a research that COVID does not kill Black people. It doesn't
Mm.
harm them. Like they are tough skin, those
Yeah,
from
melanin.
Africa.
Melanin
Yeah, that
stops COVID.
COVID does not touch us. So it's better we go inside the COVID room. I'm talking
Melanin,
like
melanin is
like
anti-COVID.
from here to here. Like how? I think, but the funny thing is, and that is where God came to show them, like He's the one that is taking care of us. None of them went into COVID rooms, but all of them came down with COVID one by one. Then we that were going, it's like the case of Shadrach, Meshach, and Abednego.
Mm.
They were not touched by the fire, but anyone who came close to the fire was touched by the fire and all of that. So that was one. The second one was the unfair assignment. They would like issue very long, a very weird assignment to us. And
Like they will give
then
you
I think I
seven, they will
trained
get two.
exactly. And then I trained also as an ER nurse. I think I've never done ER. So it was another opportunity for me to get that. I got my trauma license certification. It was a whole lot of this thing because I needed that to work there. I got that one and then I was able to work in the ED. It was a wonderful experience, me getting that like the ED vibe and all of that. But then they'll make me work ED and also still come back to work med surg. Like I have patients waiting for me med surg.
Mm.
And then when a patient comes in the ED, like they might say, okay, you take the first, you take the second, you take the third. So when the third patient comes, I might be my patient, they'll come and call me your third patient. Is here, you're next to take. Like, how do I navigate both places? So it
Mm.
was crazy. And then there were particularly two nurses that were top on the game with this. I think on one of them, one of the ways that we learned how to address conflict, you actually meet the person, talk with the person, like have that dialogue. Now, if that's not working, you tell the person how it's hurting you. Now, if that does not work, then you step up the ladder, like report to a higher person. So I actually met with this person and talked. Omo, it's like Pharaoh. When I go back, the lady will do another one again and all
Mhm.
of that. Like she was just mounting the like if I come back and tell her this thing you did, I don't like it. I'll prefer you actually do tell me this or you do this, but don't come up to me. Don't be disrespectful and all of that. I'm also a human being. Don't treat me like I am less. I am that vocal. And
Mm.
then when I go back, oh, she's doing the worst. And then, unknown to them, I think on some occasions we overheard them when they were saying the kind of assignment they would give to me and my partner,
Mm.
and it was the worst, the shittiest assignment. Why they themselves they'll be killing. So you
Mm.
see us running up and down and all of that. But
They
I
like it.
reported they were just
Oh,
happy
they
that they
like
were
it so
seeing
much.
us
They'll be
suffer.
like, how can I
Oh
help
my
you?
God.
If you need help, let me know. But they don't
Let
really
me
mean
know,
it.
but they were not helping us do anything. Like it was that bad. And then the last straw was this one was now not now personal. It has to do with a patient. A patient's life was at stake. And one of them felt like I was not worthy enough or I don't know anything enough to contribute in that situation. So background, when you come on assignment, they have a code list, like an emergency list. So on the board, they list it out. If there should be a code or a rapid response, Cynthia, you handle the monitor, like you're the person who's going to be reading out the reading. So guys, if you don't know your EKG readings, please, if you don't know your EKG readings, go and know them because you can be in that kind of situation.
Come and
So
register for our
you are
EKG class.
so you can be the one to handle EKG, you can be the one to do medication, you might be the runner, you might be the whatever, the person who's going to do chest compressions. So on this particular shift, I was told that I was going to read the monitor. So it means I'm not going to do anything. I'm just going to read. And it is up to me to bring out my skill to tell them that there is an abnormal reading or there's something else I'm seeing on the monitor and they should act accordingly. And this patient was having I think it was SVT, and they tried maneuvers, it wasn't working. I think they reached out to the doctors and then they were like, okay, start this and all of that. At some point, they got the heart rate controlled, but then this patient started desaturating. So now you need to give oxygen or up the person's oxygen. This patient was already on the, I think that is BiPAP. Yes, he was on the BiPAP, but he was still like He was very, very much conscious, was on the BiPAP. But despite him being on the BiPAP, he was discerning. I looked at the monitor and I said, this is what's happening. Can you guys increase the oxygen? Like take this patient to 100%, leave the whatever setting, max this guy's oxygen level on the BiPAP, take him to 100%. Let's see if we can get him going and all of that. And then we're calling respiratory. And then the lady kept me quiet. And I said it the second time. She didn't say anything. They called me for another patient. So I was like, well, two nurses are here. So let me step out and go see my patient and come back. By the time I came back, I think they had called respiratory. And respiratory repeated the same thing that I was saying, the respiratory on call. So she was on her way coming. I think she lived like 5, 10 minutes away from us. So she was driving and she was like up the this thing. So they were like, how would they operate the BiPAP machine? And she was trying to explain and she stopped and said, who's the other nurse you have there? And they said Cynthia. She said, yes, call Cynthia. Cynthia has done knows how to operate the backpack. She knows how to increase it. Because I did you see the COVID experience when they were sending me to COVID room. That was where these guys taught me Vapotem and a whole lot and all of that. So I could maneuver and do what I want to do, but they already secluded me, like just look at the monitor and stay there and tell us what to do. So they told them to do this thing. These ladies refused. Put this patient's life on the line. And instead, I caught them watching YouTube how to manipulate or work on the bypass. Like, how dare you? Like, are you okay? What kind of nurses are you? And by the time I was saying it, like, I didn't know this was the back conversation between them and the respiratory. It was later on. And then the next thing, when I was like, can you guys listen and max this thing up? The next thing she told me was, get out of the room, walk out. And I was like, excuse me, my name is there on the list, and this is what I'm assigned to do. I'm only giving you guys my feedback and all of that. This girl, she was charged, and she walked me out and closed the door. There was a police officer in that room, and because of the kind of patient they had. So the guy looked at me. I didn't say anything. Olokpa is there. I don't want anybody. I am black, first of all. It's already like going to a disadvantage point
You're
before
at
he
fault.
will say anything. So I walked out of the room and went to go sit down. The respiratory came inside. Oh, Cynthia, how far did you get to do it? I was like, do what? That was when I knew that they already told this charge, whoever she was, what to do. And she came in and then she did that. At that point, the day shift nurses were coming. The day shift charge nurse came in and she saw everything. I think the respiratory told her that I told them to do this. And they came to ask me, I was like, this is what happened. That's the cop. I think he's a law enforcement. He's not supposed to tell a lie. Let him tell you people too. So they were the ones who now escalated the issue because I've been reporting how these guys have been like treating us
Treating
and
you.
all of that, but it wasn't working. I think the
Wow.
matter got to the CEO, the matter got to head of HR, and to get our own side of the story, the CEO invited me and my partner for lunch. We sat down and then they started talking. But at that point, I'll not lie to you, I'd already told myself I was done. I called my agency and I'm like, send me out. I'm not going to work here anymore. Besides, I think on one of those, before this incident, I heard where the girl was like saying something like, that she bought a gun that's in the glove compartment and all of that. And she's this kind of person that she's sporadic, like the way she's thinking. I've worked with you for almost how many months? I know what you can do. Well, I will not tell you, going back home, my house was just 3 minutes away from the house. I will drive around the city. So
So that if somebody is following you, the person will lose.
I was not ready at all. But the thing made me uneasy to work as and I couldn't work effectively or efficiently in that area. So it was not a good experience. They
Wow.
tried to keep us down. They tried to increase salary. I said, "Oga, see, if you like, increase this money to $50, $60, $70, $80. I am leaving. I cannot work here." I think they sacked the nurse and the other person, but me, I was like, send me out. And then I left the place. So it wasn't a good experience. Like I was traumatized to the point that in my research when I was doing research in my BSN program, they were giving an assignment. Everybody was doing fall pressure ulcer. Me, I did nurse bullying. It was like to show me I had to embody my research, my project on nurse bullying in that work,
Well, see,
and I
it's
was
also
so
a way of
passionate about
venting.
it. It
Yeah,
was
so
a way
that
of
you can
venting.
vent, vent.
It
Because
was
if
a
you
way
don't
of
vent,
venting.
the thing is still
Yes,
there. Wow,
yes,
that's a good story. And yeah, so without wasting much of our time, we want to go into EHR and EMR. So I want you to give us a good, intro into EMR as somebody who is like a novice. First of all, I know that you came in, you went into nurse, being a nurse informatics, and that is actually the area of EMR, because it's all about
hmm
computer, everything. So you are the best
yeah.
person to do a full-blown lecture on EMR. So you have 10 minutes. You have 10 minutes
Okay.
to walk us through EMR the way that we can understand, and then from there we can continue. Also remember to let us know like the components, like the MAR, things that you find on EMR, likely things that it can help us to, that we can actually use EMR
Okay.
to do. And
Okay.
for those that don't know what EMR is, please kindly let us know what EMR is. It's a short form of something. So just let us know what it
Okay.
is and then go from there.
So this is another lecture mode. All right,
Yes,
let's
lecture
just get
mode.
right to it. So EMR is electronic medical records. It's often confused with another abbreviation. Both of them look similar, EHR. EHR is electronic health records, while EMR is electronic medical records. EMR is like your unique file. You're in a hospital, everything about you in one file. That's just it, like your own patient, your record in that hospital. But when you now look at the EHR, and why I'm saying this is that most times we try to like interchange the words. I used to be that person until I got into informatics, and then I noticed that, oh no, they were two different things. The EHR, the electronic health record, is like um all your records in different places that you have been. Say you saw you saw a dentist in their dental clinic. You have a record there. You went to your primary health care provider's office. You have a record there. You are maybe you're on pain management. You went to a pain clinic. Your record there. So all your records in these different places that you've been to, those are your electronic health records. But your electronic medical record is just in a single place. Say you are in a hospital. In this hospital, you are in um so and so hospital. Apabio and Co Hospital. That's your record. That's electronic medical record, and it contains a whole lot of things and basic demographics and things about you, your patient, your history, which can be your physical history, surgical history, medical history, surgical history, family history, smoking history, tobacco use, and all of that, alcohol, social history kind of. And then you also have your medication list, your allergy list, you have your name, your date of birth, if there are any other things that we need to know about you, it's all right there. So, like I said before, when I log into a patient's file, electronic medical record now, when I log into a patient's electronic medical record, these are the first things I see on the storyboard. I see your name, your image, if you submitted that, she, he, or how you want us to identify you, language, your code status, if you're a full code, or you are a DNR or DNI, or with some exemptions. We'll see your emergency contact, the reason why you are here, your height, weight, just basic demographics and other medical story. That's all you see on the EMR. And it's different from the EHR that I already explained before. Um, with EMR,
Cynthia, are you there? Hello, Cynthia. I think we lost her for a minute, but I know she would come back. If you guys are getting value for this session, please kindly on the comment section, please kindly just put value there. If you know you're getting value for this, because this is a very interesting topic that I want everybody to get something from. So if you're glued to your screen and you think this is a good topic, you're following, you're getting value, I want to see you comment on the comment section. I also want to say, for those that have been putting down questions about city, different places, I have in mind to bring people from different places to this program. I know the first thing that we're going to be doing next year is to be organizing like a state exposition. Like we can bring somebody from Texas and then we'll bring somebody from Virginia, and both of them will come, and then we'll just have the clash of titans, and they will just, tell us things that we can enjoy if we are to come to their state. Okay, so we're going to do that. It's part of our plan for next year. There's a lot of people that we can use to do that. So Cynthia is already logging back in. And once she comes back, she will continue with the EMR, EHR lecture. Okay, Cynthia, you're back. I think we lost you for a bit. All right, so you ready? You can unmute. You can unmute yourself and continue, please.
I'm sorry, I'm sorry. I was trying to take out something and then I hit um a button that I was not
Exit.
supposed to. So
It's okay.
basically this all I explained is just EMR, like what it entails, what it's all about, and all of that. Medication administration record in MAR, you find that also the um in the in the EMR of this patient, and that's when you now leave the storyboard and you're fishing out other things that other there are other components. You have a chart and note review. You want to see, oh, what happened the last time this patient was here, and how like a trail of how the patient has been visiting the hospital, if the patient is a frequent flyer or and all of that. Um, you also have a flow sheet where you do your assessment, where you do your vitals, where you do your intake and output, and any other thing that's peculiar to this patient. For example, if the patient is on CWA, you want to put that. If the patient is going for surgery, these are little things that you can wrench into the record, the space that you're working in for this patient and all of that. They are not like your norm or your norm for this patient, but you can wrench them in and use it to work and take care of this patient. You have the doctor's note, and or not only the doctor's, it's just notes. And on this note, you have anybody who is involved with this patient, the case worker, social worker, transitional worker, the the primary doctor, additional doctor. Say the patient came in with weakness, you see the general team and internal medicine, and then maybe they find out that this patient is having stroke. Then you have the neurologist notes coming in. You have if the patient is going to be on a certain medication that pharmacy has to work on, say vancomycin or gentamicin, those drugs, pharmacy have to dose it. You see the pharmacist note on it. So it's like a comprehensive, and also you, the nurse too, you're also allowed to put in your notes a summary of what has happened with this patient, or things that have happened, or anything that is useful to put in there, your documentation, you put it right there in your notes. You make it. And I always say this: don't go small on the note, go big, because the more you document and you elaborate, if anything goes wrong in the future, they can always make reference to that note. Say for example, something happens, they can always go to your note and say, oh, this nurse reported this and she told the doctor. Now they will not blame the doctor. She reported to you, what did you do and what did you not do? And you that way your documentation, as big as it is and all of that, it has saved you. You're detailed enough in that your document. So I'm actually big on nurses being like going big on giving detailed documentation in the notes. Summaries, you have admission navigators, you have discharge navigators, you have secure chat where you chat with other other healthcare teams. Say I want to talk with someone who is in the radiology, I can send them a message, and I want to talk with someone, I want to talk with the doctor or send them a message, and I have that right there. For some hospitals, they have them encrypted, which means that whatever you do in the whatever you do in the chat box does not come up, it's not going to be useful. So that one thing I try to do, and also tell people, whatever you tell the doctor there, please go and document in your notes that you actually said this at so time and this, just to cover up your bots and all of that. Now that's one thing with the EMR. With the EHR, like I said, there are different documents and all of that. There is a repository, like everyone comes in one place. There's something that I found out in my informatics journey, and it was Care Everywhere. And Care Everywhere is like a central area where um any doctor, say you saw a doctor, you went to a different hospital, maybe you had an emergency and the ambulance takes you to a different hospital and not the hospital that you would like to go. The doctors, when you come back to your own hospital, you come back to see your team in this hospital, they are able to go there and pull out your record, see what really happened, and be able to like make better decisions for you and all of that. For a new nurse coming into the US, I would say for me it was not so much of a shock. But I don't know if I'm going further. It was not so much of a shock for me using the EMR or the EHR system. Like I said, if you can use a computer to write your NCLEX, you can use a computer when you get here. There are just some basic needs to know. And trust me, every day you're growing, you're learning more. Um, I'm not even as an informatics nurse, I am not. I don't know, so I don't know everything yet. And that's because sometimes the system gets upgraded or there are features that I never knew existed. And then I find that out. And this is where you meet your colleagues or you meet a super user. I think I became a super user, encouraging or teaching other people how to use, find out new things and all of that. And we have a group in the hospital too and all of that. So it's not going to be much of a problem for you getting into the US and using. Just know your basics with computer. So if you're 60, you're 50, you're 12 years old, you're 30 years old, whatever age group you're in, for the fact that you can use a computer, you can turn on the computer, you can put in your password, you can click OK, you can type sentences, you can use your mouse and navigate to where you need to point and where you need to click. It's like the basic foundation you need. When you come into the hospital system, there's something they call the orientation phase. They actually teach you about their computer or their system, the kind of system they use, the technology they use. Over here, there are different types of electronic health record systems that are being used. We have Epic, we have Senna, we have Meditech, we have Allscripts, Sunrise, Matrix, Point Click, and all of that. There are just so many and all of that. So you just need to learn. They know that you're coming in from a place where you have used this one, so they have to train you on how to use this. My key takeaway for, or what I think I should tell you guys is, when you get to that point where you need to learn, where you're a new immigrant, just first of all, don't be afraid. Ask questions. No question is dumb enough. Ask. Even if you have asked it before, ask again. If you're confused, ask again. Just be very polite and ask in a nice way and all of that. And they'll always help you. Even if they go back and talk like, this nurse is very slow, he's very dumb or whatever, don't look at them. You are here to learn how to use that system. I've not used, there are some systems that I've not used. I'm going to ask you questions because it's different from what I've been used to. But when you come to my field, I will tell you this one, this is it, and all that, because now I'm a super user on it. But when I go to use on that system, I'm going to be very, very much attentive. There are basic things you want to know, but and there are many things that you need to know, but keep the basics to what is pertinent to you as a nurse. You want to see others. You want to see your flow sheet where you have all the vital signs, where you have your intake and output, where you make your notes, where you do provider notification, where you can range in things. You want to see your medication administration record, know how to navigate that so that you're able to give patients drugs at the right time. You want to see it now be able to navigate the lab area, because for some medications you are looking at the labs to the lab values and you're telling yourself if I can give this medication or not. For instance, this patient is scheduled to have a potassium pill, and you're seeing it right there. But then you look at the labs and you're seeing a lab value of 6 point something. Would you still give the potassium pill? No, you're not going to give that because the potassium level is already way high. Then you're looking at it. At that point, you're not going to give that medication. Highest, what you do is the next thing you want to do is to report to either the pharmacist, like, hold this, and report to the doctor that did they get to see this? Can you hold this? Can they give an order to hold it? And for some doctors, they will tell you, thank you very much. And automatically they will hold it. They are not going to open, or it's going to be a hold and lock from their end. Nobody can manipulate it except them and all of that. That way you're keeping patients safe and all of that. So you want to know these certain areas. You want to know your notes, be able to read through the doctor's notes, know the plans and all of that, and also be able to do yours at the end of the day. So this is it. There are others. Yes, there's another column again, or page, the order page, where you see all the orders for this patient. You want to go through all of them and see which one needs to end and which one needs to continue and all of that, or which one needs to be added. For example, if a patient has stroke and maybe the doctor puts in orders for stroke, and then they forget to put an SCD, a compression device, you can say, hey, I can't find orders for this, because you want to also put this patient on one of those VTE measures, even if it's mechanical, which the compression socks fall into, and then you can report that. And also you want to also look at the orders or find something that needs to stop or needs clarification. For instance, if this patient comes to the hospital and what they call it, you are seeing a glucose, like PRN, what to do in case of glucose, and then you're looking, this patient does not have a history of diabetes. It's a point for you to reach out to the doctor, like, please, can you clarify this? Because sometimes they have an organized template that they just like copy and just put in, and most times they don't go through it because they have lots of patients to look out for. So it is you now looking at those records, that order, and you're going to, like, can you explain why this patient is having glucagon and dextrose and all of that? I don't see a history about this, and I've checked the lab and I can't find anything about blood sugars being high or being low. That's the hypoglycemic management. I don't see anything that this patient has this. Is there a reason why? Or you see an order for check blood sugar every 6 hours. You want to ask questions like, I've read your notes. I don't see anything you guys like suggested of this, and there's no history of this. And then you might get one information. They might say, oh, we just want to monitor for about 24 hours because the patient came in looking so unconscious. We want to make sure that this was this, and this, or the patient came in with a blood sugar of 68. 70 is the norm. 70 is the norm, but the patient came with 68, but they did something, but they just want to like make sure that there's nothing going off with this patient, and it will help them also to take care of this patient better. So you want to navigate all of this. Another thing that I would like to point out with the EMR is maintaining privacy, confidentiality for this patient, the HIPAA rules. You don't want to leave your computer open for bypassers and even your colleagues too. You want to maintain privacy for this patient and keep everything, every detail about this patient confidential. We know the part of don't discuss them in the hallway, don't discuss them here when you are this, or call their patient's name and all of that. But we also want to make sure that in the meantime, that their records are not just open, like you're working on the patient and maybe another patient calls in. Minimize that page or log out and then come back, go attend to that patient. When you come back in, you open it. You can minimize it. A blank page comes up. When you come up, you just open it back, and then you continue from where you stop. That way, you're giving that patient's story, medical story, some form of privacy too. So That's basically it.
Thank you so much, Cynthia. And you've done justice to that topic, and I don't want to add more, but I'm tempted to ask you what are the different types of EMR, because I know some people who this is new to would like to go ahead and start researching, what is EMR, what are the types that you use? Like I know there's Meditech and you know that. So
The
what
systems
are
need,
yeah, the systems
yeah.
that are being used, what are the types?
Okay, I think I kind of like mentioned them in passing. We have Epic. Epic is what I use, and I'm big on Epic. Like, I'll come back to Epic later, but we have Epic, we have Cerner, we have Meditech. The few that I know at Meditech, right? Yes, we have Allscript, Sunrise. For some nursing homes, they use Point Click and Matrix.
Mm,
Point Click and Matrix. Those are the common ones I know I've seen with some nursing homes and all of that. But I'll speak with about Epic because I think I've oh, I use Centric too. I used Centric when I was in Kansas, yeah. Centric, yeah, and all of that. When I was in New Mexico, I used Point Click and Matrix and all of that. I haven't used Senna, but I have seen Senna like before me. One day I went for a shadow assignment. I've also seen all scripts Sunrise too when I went for a shadow, when I was testing out jobs, different jobs that I wanted to take and all of that. But I think I looked at everything and I'm coming back to Epic. Other ones, their ease of navigation, which is where informatics come in, is so poor. No, 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 no. I want something that it's very straightforward, very visible. Please don't confuse me. I have a lot on my head, and I have vital signs on one part. And I have, like I told you, I have four patients. One patient is here, one patient, one patient, one patient. I have their vital signs. I know who is bad, who is not good. And then you want to give me a confused system to work with. You're just going to make my work crazy and tedious. And that's where you see nurses, they are like, the work is too hard, the work is too hard. The work is too hard is not only about the patient care, the work is too hard because of the system that is being used. So Epic is kind of like they are optimizing they are tweaking a whole lot of things. They are making it so easy. There are features that you can put on Epic to help you remember. They have tasks, they have reminders. So when you see it, you are like, because you are the one who set it, say you want to check blood sugar just for your own consumption or for your own sake. The doctors, maybe you've told them, oh, put this patient on this blood sugar checks every 6 hours, and they're refusing to. See, cover your ass, you go do your own blood sugar check. So you might put those reminders like to do this so that you can have something to remind you, oh, it's time for me to go do this. Or say a patient is 2 hourly turning. You may not remember every 2 hours. But anytime you open it, you look at it because it's stationed on a particular time. You'll be like, oh, 9 o'clock, he said, let me go turn my patient, and so on and so forth. And on the brain, Epic has something we call the brain. When you log in and assign yourself patients and pull your call in and everything, the next thing you're seeing is the brain. The brain has the activity of everything that you're supposed to do for this patient from the start of your shift to the end of the shift. You're able to see where you need to do medication, where you need to do something, and when you need to take labs. He just adds it. So you adding those tasks and reminders in between are just to help you make sure that your shift goes where you're reminded. Maybe you're not the paper type of person. So you just see it right there. You might be in another patient's room and you log in and you say, oh, when I'm done with this patient, I think I see a task or a reminder. I'm reminded to go do something else for this patient. So I'm actually big on Epic. Their navigation is so easy, so beautiful. And like no, you will enjoy it. I'm not saying about others are not. I don't know how every other person is coping, but
mm,
give me an Epic hospital, I think I'm able to like blend in faster as a nurse. I've used
yes.
other systems, but I kind of like how their system is and all of that. And each time they are always doing research on how to make um
Oh,
they are
easy.
how to make the workflow much easier. They're just trying to make things, they're optimizing to make things much easier, and I kind of like it for them too.
Nice,
So
nice. Okay. Guys, if you're getting value for this session of EHR, EMR, so just do me a favor on the comment section, just write value there. Value plus plus. I want to see a lot of values. I didn't see a lot of values the last time. I want to see a lot of values. Can we have
oh,
values? Can we have, where are the values, guys? I want to see values. Yes. Can we have more values? We have more than almost 70 people on the show. So can we have value, please? Can you guys give me values on the comment section? All right, good, good. Yes, thank you so much. So, Cynthia, we're gonna come down a little bit to more of, I know you've done justice. I know there are questions. We're gonna take question at the end, but I want to talk about like any cultural shock that you had, be it clinical or cultural, when you came to the United States. Of course, this was your first time coming to the United States, so was there any cultural shock that you witnessed, be it in the clinical area or anywhere around where you live? Was there anything that you felt like, oh, this is kind of different from what they usually do from in back home or wherever you're coming from? Is there anything like that that you would say, like, you that would be worthy to mention about your coming to the
um,
United States?
yes, I would say I did have some shock. Yes, but I would say I was somewhat prepared. And that's what I mentioned earlier when I was back there, like waiting for my time to move. I used that period to grow. I used that time to learn a lot of things. And like I was telling you, background was decency. My journey in nursing, I always knew that I was not going to practice in Nigeria. I didn't know where, but I knew that I knew I wanted to have um, a form of Western experience, nursing experience. So I started right from nursing school. I was so selective. I'm not saying this so that anyone will feel bad, but this was what I did. And for new nurses who are just out of nursing school, this is what you can also do. You can strategize, plan, pray, and trust God to lead you. That does not mean that if you see any other way, you should leave it and all of that. But this is what I used to build myself for the process. I already had this vision in mind. And so I targeted the kind of hospitals I worked with back home in Nigeria. For those who are in Lagos, I worked with Lagoon Hospital. That hospital really gave me my footing in nursing, and also about Western nursing, American or whatever, Western kind of nursing. In Lagoon Hospital is a JCI accredited hospital. Over in here in the US, you hear there's something they call JCO, JCI. They have other bodies that are accrediting hospitals. So Lagoon was a JCI accredited hospital. I think they come with that every 2 years or every 4 years to accredit, and it's a whole lot. They are big on documentation, they are big on protocols, they are big on policies, they are big on normal things like no straps should be here, no bags should be here, like safety. They are big on disease prevention, even from the workplace. They're just big on everything. So Lagoon Hospital, I give them kudos to this. They actually gave me a footing about my journey. And then I learned these policies and every other thing. And then I moved to Abuja. I was also selective on the kind of hospitals I worked in Abuja. I worked in Abuja clinics. Abuja clinics gave me the vibe of your the what I went in with Abuja, the mindset I went in there was I was going to be dealing with high profile patients. So how would I approach this? Back then in Lago Hospital, we learned what they call soft skill. and which is basically communication, empathy, and all of that. So I was able to apply this in Abuja clinics, and I could relate well to the high and mighty in Nigeria, no matter their offices and all of that. I will talk to you respectfully and all of that. Know your onions too as a nurse. It's not only about learning all of that. You want to also know, bring value. You want to have that value and also bring value. Know your conditions, know your drugs and everything, be able to educate on the spot without them without flinching or biting your tongue or acting looking like you're lost and all of that. You're able to do that. So I think I learned that from Lagoon Hospital, brought it to there, and then I moved to work with another international organization and then back to Gariki. And all of these experiences, I worked with computers. I was big on what kind of thing, the systems that I was setting in place. So coming into the US, I already knew what JCI was all about. So I knew what they are big on. So coming in, I didn't flinch when it came to safety, security, health disease prevention, health promotion. It was already on my fingertips. The only thing I just wanted to learn was what is your hospital protocol? What is your SOP? For the different hospitals that I've worked in, the first thing I do when I come in is I take off whatever it is I've learned about the other hospital. It is you, this hospital. Tell me, because every hospital have their own
Policies.
protocol, policies, how they operate, their modus operandi. So I unlearn that one and then I come in to learn yours again. And then it just kind of like builds me, like I'm able to know this. There is a norm, a general norm, which you will learn for the NCLEX. But when you come into the different hospitals, they have like different values, range values, or how they do their stuff. So that was another way I could adapt and all of that. Um, for the culture itself, hmm, food, food was a problem for me. I tell you guys, when I was living in Nigeria, the only thing I came to learn to this place it was food. Though. I left all my clothes in Nigeria. I told myself I will go and buy $1 top and $2 top. Who send you? When we start making the money, we buy clothes and buy designers and whatever. But I came with food.
Mhm.
I got all the egusi and all the everything because I didn't understand what was going to happen. First of all, my shock when I went to Philippines to go write the exam, and I saw how no, I couldn't cope. I couldn't cope at all. So I was like, Cynthia, if you're going to this place, you better pack yourself. Oh. Some people were like, no, you have to come with Ankara. You have to. Nobody sent you with your Ankara. I came with food, all the kind of food that you think of. I packed everything. I packed all the dry leaf, dry bitter leaf, scent leaf, everything. All the ogiri. I came with everything. I was prepared to live life. I didn't want any problem because I didn't know what their food was going to look like. And I'm not going to say this. I think a few weeks ago, someone asked me, we were at a church get the hangout, and she said, Cynthia, how are you coping this and this? And I said, your food here, well, like, it is bland. Sometimes
Mhm.
I have to
Yeah,
go
no
with
taste.
my own pepper.
Yeah.
So
Yeah.
I can eat. If not, I will just feel nauseated or something. At the end, I end up with only salad. Meanwhile, I'm hungry and salad is
That's true.
looks nice. Other things I don't understand. This one is sugar. This one is tasting funny. So food was one thing that even till today I don't think I've been able to like adapt so much and all of that. Driving is same thing with Nigeria, just that now all eyes are on you. It's not in Nigeria that you can act anyhow and get away with it. So if you are coming and you are a James Bond in Nigeria, calm down, chill. If not, you will have speeding tickets, and you'll be paying or even go to court. And the funny part is that for some cases, it stays on your record for years, like up to 5 years, I think. Three to 5 years, it's on your record. And it will affect your insurance. We pay more. If you were supposed to pay $100 because of that speeding ticket, you will pay almost 200 or $300 because of that, because they see you as a risky driver and all of that. So that one is something that you want that I had to like watch how I how I started driving over here. Watch all the traffic lights, all the rules, and every other thing. I think I also had a driving class to get the license here to be able to drive, and the guy was like trying to do this. I was just looking at the guy, okay. It's not that I cannot press this accelerator. I'm just trying to mind myself and respect my ancestors in this place. Let me not disgrace them. So that one too. Driving too was also another one. I'm using the map and all of that. It was also a game changer. It was also it was good and all of that. At the workplace, like I told you, my story of bullying. It wasn't nice one. I didn't expect that it was going to get that bad. I know that yes, even in Nigeria, we have nurses that were not our clique and all of that, but I didn't know it would get to that extent. It was a shock, and the way it was being managed, I kind of like I think what I took away at that point was hospitals tell you one thing and like they tell you in their protocol, and then when it start happening you are just left on your own, or they downplay it, and it's not such a good thing. So that was also something that didn't settle well with me. um the weather. Hey, no, the weather was also another shock. I knew that they had the different seasons, the fall season, spring, summer, and winter, and all of that. But I think with every region, they have what's peculiar to them and what is not. Like you can't see me go to Dakota or Vermont. Those people they are drowning in cold and snow like Canada. And oh, you won't see me there and all of that. I don't want to freeze to death. I'm too lazy to pack snow and all of that. So the weather too, and then the fact that you have to now start dressing according to the weather. It's not a time for you to show off dressing. It's a time for you to, you don't want to catch cold and all of that. Another big shock for me that here was the insurances, the different insurance. You have your health insurance. You buy a car, you have a car insurance. You buy a house, you have a house insurance. In fact, no, you are paying rent. You are paying rent in a place. You are paying renters insurance too. Like is that like everything just has insurance? You buy a phone, you are given an opportunity to buy insurance too. They're just like different insurances. And the Nigerian Igbo girl in me, you would always calculate so at the end of this, if I at the end of the 1 year or the period I'm paying for these insurances, if nothing really happens, say for the car, will you people give me my money back? Or let me keep that on aside. Let's talk about the health. I never visit the hospital in a year, but every month I'm paying $200, $300 every month. That is for single. Then if your family, you're paying almost $1,000 every month, and your child never goes to the hospital. Like serious in this thing, they will not give you back your money. All your money are good like that. I'm still like, this money is too much to spend, though, and all of that. So that was another one for me. Then education. Education was another thing that I think I was not used to online because I did my BS and even my master's online. Apart from when we had to do the clinicals and then you go to a site where the only time you can reach out to your instructor or whoever is when you have an issue, you send them an email or through the portal or their text message, and whenever they have the time, they respond. It didn't work well with the way I learned. It didn't work well with my own learning system. I love to have one-on-one conversations with whoever it is that is teaching me, so that I can be able to like relate better, understand better, and it yes, you're paying car insurance every month, every month, not even a year. You're paying every month. So what was I saying for this car insurance and all of that? So those are the little culture shocks for me when I got in. And each day we keep learning and we keep adapting and we keep growing. And so it is.
Thank you so much, Cynthia. Thank you so much for that information. I really appreciate you going so deep into giving us like insights to all the cultural shock that you felt when you came to the United States. At this point, I think that my next question before I open the floor for everyone to ask their question is I know you do a lot right now. You do your normal bedside nursing, and then you also teach in a school, and then you have this program that you started. I think it's called Health and Wellness or something like that.
Oh, faith
And
and
then
wellness.
you're
Oh,
doing
I
a lot of
started.
things. At what point, how do you balance all these things? Do you even get time to rest at all? How do you balance all these activities? Please just let us know and give up more insight into the health and wellness program. And if you can drop your handle for our people to follow you, please
Oh,
drop it. Yeah, drop it on the comment section.
so I think everything that you do actually requires planning, enough planning. I'm big on planning. In fact, like the next 1, 2 years, I think I've planned out, oh, this is this, and this is that. And then I just trust God to help me navigate through life and all of that. So I'm big on planning. With effective planning, you can achieve anything and everything and all of that. You write down the plans. Habakkuk to say, write it down, write it down. This is it. So I'm big on planning and all of that. Then balancing work and school. Let me start with that one. It was challenging. Oh yes, it was challenging. And you on the work side, you want to first of all do your normal shifts, and then the bonuses that come with picking up shifts, you want to do that because you want to make money. At that point, I had to ask myself which one is better. If I pick up this shift, I'm not going to meet up with my school target, and it's going to affect my school grade, and it's going to affect my school grade. It's going to keep me on the edge. I will not meet targets, and everything that I've planned, I think it will flop. You have to find out which one you would raise up and which one you would let go or downplay at some point. Um, Work and school for me was a little bit challenging, and I practically had to find a way to work around it. I picked up shifts on when I knew that the class load is is not so much. I don't have so many to do. I just have to write my discussion post, make my supportive posts as required by the school. And then the weekend, maybe there is no paper to write. Oh, I'm going to go pick up all the shifts I want to pick up because I know that the next one I might be so busy. So the school already has a curricular or a part, an outline for you. So I look through it and I tell myself, this is what I'm going to do on these days that are looking like a downtime for me in school. I think I might increase work, um, my work life more, like pick up extra shifts and all of that. And when it's getting busy in school, well, I just do the minimum. I just do my basic and then go. Same thing I also did with my master's program. I think at some point during my master's program, when it was getting much like demanding and taxing informatics, at some point I started crying. I said, they did not tell me. Oh. And there was nobody to even tell me, oh, this is what you will meet and this is what you will not meet, and all of that. I didn't know that I was going to start coding and running queries and learning how to build visualization. I didn't know, although I did not know anything, Python, SQL, all of that, charts, Tableau, all of I didn't know anything. So it just came like a shock. At some point I started crying. I cried and cried and cried, but at the end, I already signed up. I had to find a way to do that. During those periods, I think I reduced my work hours, and that was when I stepped down from my position as Director of Education in Decency Academy so that I could meet up those targets and all of that. So it's basically finding out what you're doing, the different things you're doing, and how to allocate your time to each and every one of them. If you're a family person, it's time for you to have that conversation with your spouse and find out how to navigate. You have kids, how many, and what is this and what it is not. If you have education, it's a discussion, a time for you to discuss with them, like, hey, I'm doing this program, this is how it is. Run it by them and trust that they would understand and support you where you need help in and all of that. If your spouse is not that supportive, please go and act like Esther in the Bible. Prayer before you go and meet them and let God touch their hearts and then have that support system too. I also had friends around who were also like shoulders that I could lean on, and they kind of like helped me through it all during those processes and all of that. But this is a good support system, was a good support system. And he was like, Cynthia, it's time for you to unwind. Come down to Virginia, and I'm on the next plane. I'm flying down to Virginia, have good time, Steph D. I'll eat all I can, get fat, and then come back and come and lose all the weight. And lose all the weight and all of that. So having good support system in form of friends or your immediate spouse is also it's also another way that you unwind or another way you can unwind, and it kind of like helped me too and all of that. So just know what your type is and all of that. For the YouTube page, I started actually lost my first Facebook page. It was just ranting. And I'm a Christian, like you all know. You've heard me call Esther, and you've heard me mention God. God is an integral part, is like the main character in my story, and everything that I am right now, it's all God. I have so many stories to share how God helped me, even on my NCLEX day. Anybody who I have mentored, or I coached you for your necklace. I will always tell you this on my first day. I'll tell you, go and hold on to God and trust God to help you. I know how God helped me prepare for the necklace. I know how he sat down with me. This is no joke. Everybody used to say they felt angelic presence, but I think I had that. So um my YouTube page or my Facebook page it's just about God. My YouTube page is basically faith and wellness. Want to see how we can apply our faith in God, what we believe in, and see how we can apply it to other aspects of our lives and all of that. Um, Without God, you can't even make the life balances that I'm talking to you about, like measuring this, planning effectively. Without God or the Holy Spirit, you can't effectively do all of that. So you also need God to do that so that you don't break down. You cannot carry the problem in your head. You need God to also help you, tell you, oh, don't do this, or He brings in a friend to help you to shoulder on that responsibility. And that's just what my page is all about. Yeah, thank you. Um, that's what my page is all about. So faith and wellness. The Bible, the anchor scripture before I started that was um First John 1, I think. Yeah, First John 1. Yeah, where it says, Beloved, I wish above all things that you prosper, be in good health, even as your soul prospers. We are here in this country to come and make money. That's prosperity. But while you are making that money, you also need to be healthy, because it's only the healthy people that will make the money. You don't want to break down. And while you're doing that, you also don't want to lose your soul to the God of money. You want to be connected to your roots. We Nigerians or Africans, we are big on spirituality. We are big on God. So you also want to keep that aspect of your life alive. You want to keep that flame glowing and all of that. But you still want to, like, you just want everything to be um I'm looking for this word, is a phrase, sengemenge, like everything's just working out in place. So that's what my page is all about. How you can use music to go through all of your days, how other wellness tips, which is upcoming, like they are coming up, and every other thing. Watch out for my next post, and how to handle challenges in life and every other thing. So that's what faith and wellness is all about. My YouTube handle is you can search for Cynthia Arundu, my name. or you can search for my page name, which is Faith and Wellness with C. The easiest would be to use my YouTube, my name, Cynthia Arundu. I think it will just take you straight there. And please subscribe, like, please watch all the videos to the end. Like, you never know which one hits you more or which one will resonate to you. And hit the notification button so that anytime I post something, either a short, a post, or something, you would get notified. On my shorts, I kind of like this one was by the inspiration of the Holy Spirit to actually do something like um a devotional where I get to talk to you. And like I just drop it's just a short Bible verse and then we expand on it and it's just a very short clip, 1 minute, 1 minute, 30 minutes. And there are daily affirmation wellness points where I think on one of them I tell you that you should tell yourself I am beautifully and wonderfully made by God. This one comes for people who, like me, maybe you're bullied at work, you say no. This one or your bullying cannot come to me. They see Africans as somehow and all of that, and it may affect your mental state while you're at work. You just go back and say no. I am a proper
Yes.
African lady, I'm a proper Nigerian lady. You give yourself those points and all of that. So expect more on the page and drop in the comment section on the page what next you want me, what other thing you want me to talk about, and we'll get to it. My last name, my surname, Arundu. Arundu. You see me in a beautiful black gown, holding a red pillow. Yes, that's my page. And under it, you'll see Faith and Wellness with C. So
Thank you
that's
so
it.
much, Cynthia. Thank you, thank you, thank you. So we're
Thank
coming
you.
close to the end of the program, and I think we are going to open up the lines now so that people can ask their questions. And
Oh,
already I have a
okay.
question from one Dr. Linda. Dr. Linda is asking,
I think I know who Dr. Linda is. Dr. Linda was my instructor in nursing school.
oh, really? Okay. So does it mean before you walk anywhere, you must write NCLEX? If even if it is a hospital or a patient care unit, is it if
If you would practice as a registered nurse in the United States, yes, you must write the NCLEX because the NCLEX actually it's like testing to see if you are able to practice as a normal nurse, like a well qualified um um a qualified nurse that knows all the concept or of what the nothing is in the United States. Yes, you will have to write the NCLEX. It touches different aspects, not only disease condition. It touches, like I said, psych research. It touches how you handle. Basically, it might not even be what is wrong with this patient determine and all of that. For my time, during my time, um, I think most of my questions were like, who do I see first? Is trying to see how you are able to prioritize your patients, how you know your ABCD. And I think in trauma, there's an EFGH, yes, to an I. Yes, in trauma, there is up to an I and all of that. But the basic ABCD, how you're able to do that, they want to make sure that you know how to keep your patients safe and keep your patient safe and increase positive outcome for this your patient. Make sure your patients are satisfied and all that. So yes, you must be. They are big on patient safety and good outcomes. So they want to make sure that you are that kind of nurse and all of that. So yes, you must write that NCLEX. If you're other caregivers, say you are a caretaker, even the caretakers, they have the CNAs, they have their own basic training and they have their own exam too, and they have a different curriculum. They also have the licensed practical nurse, which is like they are not registered nurses, but they can do some activities that the registered nurses do, but they are not the registered nurse. The registered nurse has a different scope, and these LPNs they have a different scope. So even if you're going to practice that, you also have to write the NCLEX for LPNs. Then you have the NCLEX for the RNs. So definitely yes, Dr. Linda. You must write the NCLEX if you want to practice as a registered nurse here in the US. And it's a whole lot of process. The Decency Academy, we are here to guide you from start to finish, getting your credentials evaluated by a good body. We have the board, which board of nursing would you want? We'll tell you what their requirements are, have that settled in, get your biometrics. And then when everything is done and you're ready, you go write your exam, and we trust God to help you pass. Now, on the flip side, while you're doing all this process, the Decency Academy is also there to help you prep for the exam in terms of lectures, very, very seasoned lectures, like every aspect we are touching it, and we'll come back again to touch it. We have the content class, we have the mastery class, we have the rebranded class, we have the about to test class, and we also have there's a general group too where they have some kind of general lecture, and we have the personal coaching or the one-on-one class for nurses who want to like they're about to go write the exam, but they want to make sure that they've touched all bases, or they feel scared and all of that. We'll come to one-on-one and we'll talk with you and figure out where your weaknesses are and all of that. Earlier on when I was speaking, I told you people that I had my one of my weaknesses when I was prepping was on psych and pharmacology, and I had a conversation with Bosti. It was not more of it was not yet the coaching, but he actually coached me on what to do about that. So we also do that there in the academy. And one thing I'll tell you, take everything serious. Study, 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 study like your life depends on it. You know what you're going through, what you're going for. You don't want to go spend all the money and then come back with failure. So study to show yourself approved. It's in the Bible. Study to show that, to show them here that Nigeria, we know they carry last, that we are also intelligent and all of that, and then come up. I think when I was telling the nurses here that I wrote my class even while I was in Nigeria, they were shocked, like how and all of that. I told them yes and all, and this is this, and they were like it exists, and I'm like yes, we did all of that. We have an academy. I think in my lecturing position, it was one of the things. The only question I answered was Decency Academy. How are you guys in Nigeria able to put that? And I broke it down and everything. So stay with the academy. If you also need your flights to be booked, you want to you want us to help you process all your reports and all of that. Yes, we'll help you do that. We can help you call fast track things and make sure that everything is going on the point. While you're doing that, we're also helping you prep for the classes, we prep for the exam. So in all areas, your flight, your hotel, we are just there with you. Like call us anywhere, we are there. We are there, we are there. If you have done the whole CS or you have done all your credentialing, we are there to help you study. If you are studying, you just need help to that, we are there. If you're like, I'm confused with flight, I don't need help here, we are there to help you and all of that. If you also need help, maybe someone should check your results, you're afraid, we will help you collect the fear. We'll help you and check the results and all of that. We even pray with you when you are going. So, Business Academy, we are there anytime, everywhere, anywhere.
Cynthia, come on. I don't know how to thank you, Cynthia. That was a great session. I don't know how best to, say thank you to you. One thing that is very interesting with all the people that come for this program is that they just pour out their hearts. You will see them speaking effortlessly. It is not a written speech, so it's coming from their heart. They are doing all that they want to do because they feel that you have to go the way that they went without having any hitches. So thank you, Cynthia, for being a great ambassador of the academy. You have never failed. You're not God, but you have never failed. So thank you so much for all that you've been
One more
you've
thing,
been to the
one more thing. And
academy.
then if you are here in the US, and if you're here in the US, we also have the decency staffing solution. We can staff it to hospitals. We have
Yes.
not grown to the parts where the other big guys they are doing you getting you over. But if you're here and you're looking for, I think I want to move to this state, but I'm looking for a good hospital, good job, good salary and all of that. We can help you make that bargain to the hospital and all of that, especially if you're coming from us. We'll help you and give you something that's good and all of that.
And a very, very good support. Thank you so much, Cynthia. Do we have any question in the house? Who has
Ah,
questions?
so
Please. So many.
so
Okay, if you know
many.
you have questions, please let's take it. Let's have the questions. Let's see. Okay, so how can one manage finances with all the insurance here and there? So,
Okay, so I'm still going to come back to planning. And I'm still going to come back to planning. Earlier on, I said that I think I've worked in different states and all of that. I was looking at both cost of living and all of that. And different states have different things that work for them. It's like different strokes, different folks kind of thing. And I chose here because one, the cost of living when I came here was very, very affordable. Um, yeah, I think there's something recently I learned that where you stay also, this is another new thing. I'm sorry, I just brought this up. The area you stay also um helps you manage your finances too. Some areas are not so expensive, while some areas are expensive. Like, okay, I'm here in Indiana. There are areas that are very expensive, in as much as cost of living is affordable. There are areas that are very expensive, while there's areas that are not so expensive and all of that. And the areas that are not so expensive, you also want to look at safety, security. Are they the places that every minute you're hearing gunshots? You're looking at school ratings, so that especially for those who have kids, you want your children to go to good schools while you're still managing all of that. Planning your finances, have a budget, like you know what comes into your account every every paycheck and all of that. And then it's not the time for you to show them back home that you have arrived, or you want to start living the life. You want to buy all the cars that you buy. There is a time for that. There's a time for car. I want to drive a Tesla one day, but it's not time yet and all of that. I love it. But I'm gonna stay on a very moderate level and all of that. The cars you buy, I think it's car insurance they were talking about. I can't remember. But the car insurance, the different cars you buy have different kind of insurances that come with it. I may not know how much it is, but I think the more newer the car, and there's this thing I got to find out when I was buying a car. They call it, there's a rating, something is safety, it's NH something 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 safety, whatever. Each car has its own rating and all of that. You want something about a 4/5 or 5/5 and all of that. It's going to keep you safe, but then there's also an insurance that comes with it. For some, you want to look at the different insurance companies. So shop around, look around and see which one gives you better coverage. If anything happens to the car and you have this kind of coverage, what does it entail? Are they going to give you a brand new car? Are they going to answer you when you are stuck on the road and you need someone to come help tow your car or change your car tires or buy fuel for you? Maybe your car, you went slow on gas and there's no gas station. Can they come through for you? Those are the different packages and all that, but you want to shop around to see what this if these people are reliable and all of that. And you want to work with that budget. Ask them questions. Okay, can I pay $500 deductible, either comprehensive conditions? Sorry, I'm going too deep into that, but you want to look into what their packages is and see if you can cut a little bit out of this. Can I still have a better coverage? Bodily, uninsured, and all of that. You just want to make sure you have the good a good coverage for your car at that point. For health insurance, I think with my time here, I would say the best insurance to get is to get it through your employer. Or even when you're getting it through your employer, check what it covers for, especially and your kids and other aspects. I think if you're paying for health, it's different from your dental and your vision too. So you want to see what it entails and see how much it covers and how good it is. so that you don't take a shitty insurance, a less like an insurance from your workplace that's not going to give you much coverage. That when events happen, which we don't pray about, you are left paying hundreds of thousands of dollars from your pocket and all of that. But with my assessment, I think getting one from your workplace would be better. Now, when you get all of this information, you want to plan with your partner. You might include your partner to your health insurance. And then if your partner is working, because they already you weigh on both sides, oh, your office or your organization gives you insurance and mine gives me insurance. Let's look for which one is better to serve us and our children. And then you go for one. And when you guys go for one, you don't need to pay for insurance on the other side. You tell them, no, I don't want insurance. I'm going to go with my spouse's insurance. Or your spouse will say, don't give me insurance. I want to stick with this one. You add them with the plan. That way, it gives you, you guys are able to save money out of that, from that other person's paycheck and add to this one. And you guys can make more money. Um, Identify stores that are close by where you can get affordable good wares for yourself and for your kids. This is not the time to go to Louis Vuitton and Jimmy Choo or any of these designers. Birkins. It's not the time to buy a Birkins bag. A simple bag. Nobody looks at you. I think it's one of the things that I've come to find out. Nobody looks at you to say what is this person wearing or what kind of car is this person driving. You just need something to take you from here to here. And you just want to look good. You're well covered. You're dressed. You're dressed appropriately, and that's it. Nobody cares if in fact I think I was shocked when a friend of mine was saying that she's going for a wedding. I was expecting she would say something like, oh, she's going to the mall. She said she's going to good there's a shop called Good something, and
It's
that
goodwill.
shop, Goodwill, thank you. It's actually like a thrift, like maybe it's clothes that other people wore, like this cloth, maybe it's now tighter on me. I can go and give it out there, and people come there and buy it. It's still very good. And she said that's where she's going to go and get a gown that she's going to wear for a wedding. I was just looking at her like, uh, and at the end, she told me, oh, I got the gown for $15. Like, yeah, from where? And that she's a white, but then that's how they live. And she's like, I have my old shoe, or she would like, even wedding gowns, you see them, they'll say, oh, that the gowns their mother wore, that the only thing they just needs to tweak here and there. You just have to find ways to different stores around you that you can get more affordable things and live life. I mentioned earlier on when I was in Kansas, and you want to look. The closest Walmart to us was the one in Nebraska. In fact, I was in the border between Kansas and Nebraska, but I would drive all the way down there because one, they didn't have taxes on certain items, especially food. So all the food supplies, all my groceries that I need, if I'll go there and get it and I will not pay tax. So something that will cost me, say, $10, $15 tax at the end of it, I've saved that money. In fact, I'll not add the money to my gas and then go home. Then I will spend the money on gas in another Walmart or something like that. So there are just different ways for you to save. The thing is, cut your coat according to your clothes. Don't put yourself under undue pressure. Work each day and each time. Work with your spouse if you're married. If you're a single, this is not the time to do dirty December. This is the time for actually plan for yourself. Get life insurances. Life insurance is another insurance again. Even for your kids, you want to do insurance to help them save for their college, and it's with just little money that you might go and spend on some other thing. You just pay that every month on each of your child, and then they are well put together for when college comes. They have this amount of money that you would not bother about where would I get $50,000 to pay for their school fees. This is something you've done for them growing up, and now it's time you're paying. You're getting all of that. That's
Right.
basically enough planning. You'll be able to move around.
Okay. Thank you so much, Cynthia, for that insight. I really appreciate all the all the information you have given out during this session. I appreciate them
Hi,
so
Christy.
much. Thank you. And then I have someone else in the comment section that is saying that this session is very educative, and they are all saying thank you on the comment section. I think
Thank you.
there's a lot of comments of people like that are just saying thank you to you in many different ways. And I don't know, is there any more questions in the house? Someone says, I feel this is Tosin from Nebraska. So someone from
Yeah.
Nebraska is also here, and the
Yeah.
person is also
I
saying
think
hi.
it's Mikuk, Nebraska. Yeah,
Okay.
Mikuk, now is the closest place
Wow.
to where I'm staying.
We
Yeah.
need to bring her on the time. And like I said, when you logged out, well, we have to bring people from different states, and we'll have like a clash of titans on this show. So we're going to start that next year. So
Oh,
if you know your state is beautiful and you want to rep your state, if you really want to be in that your state, continue to be in the state and rep, like, promote your state, you come here, and then I bring another person from another state, and then we'll just do like a battle. You just tell us how beautiful your state looks and why we should choose your state and not the other one. So I
yeah.
don't know, but I think that Virginia
Just a
is going to
cutting,
win.
just a cutting. I think 2022 or 2023 get together and in this I think we had clash of states when
Yes.
we were playing the volleyball at the beach.
Yeah, yeah, yeah,
And
yeah. We
then we
did
had
that.
Virginians and
And
outside
Maryland
Virginians, and we were all playing like who is going to win
win.
the
Yeah.
different competitions and all of that. It was
No,
a
we're bringing that
wonderful
back. We're,
experience.
we're definitely
Yeah,
bringing
yeah.
it
No,
back for
I've missed
next
it. You
year.
guys should bring it. Now I have
No, no,
time.
definitely.
I have
Yeah, yeah, yeah.
time.
Yeah,
So
we are bringing it back for next year. Okay, so
yeah.
Cynthia, I want you to give your last remark. Before you give your last remark, I have an assignment for you. So in this session, in this platform, we'll have people from different languages, different background. So they are going to say thank you to you in different language, and I will have
Hmm.
you read out those languages. I want to know how good you are with languages and
Oh,
pronunciation. So get ready. All right, guys, you know how we do it. So go ahead on the comment section, say thank you to our guests in your own language. I'm waiting for you to say it. And tell us where the
sugar.
language is coming from. Please always say where the language is coming from so that we know what we are speaking and where we are actually, learning. Okay. So confidence, if you don't mind, let us know. Okay, that is from Saudi Arabia. All right. So now let's see. Do we have other people that have other languages that we need to learn? Okay, make sure you pronounce that Zambian language. Okay, I'm waiting
Okay.
for you.
Okay. The first one, shukra. The second one is wait, hold on one second. Hold on, you guys should hold on. Wait. Shuneske Shunase
This
Keliko
is my
Lunda.
most enjoyable time of this session when I get to see you say things that
Hunaske
looks like.
Lunda. Wese. Sonsono. Eche pupo. Dalurinde, yeah, so Iwali ala, Ngala Zoro, Ngala Zoro, Ndewo, Adupe, thank you.
That's good. That is just us saying thank you to you from different
Thank
language. So
you.
your final remarks to us, if you have
Um,
any remarks, just one word that we're going to hold on to and leave, this program remembering for a very long time.
okay. So it's my mantra anywhere and everywhere because I've seen it work. Hold God. I don't know how you want to do it. Submit, surrender, or hold God. Trust God. Whether you're in this process, you're waiting, you're preparing, or you are already here with us. You're already here with us in the US, or you're about to come in from another, whatever. Just hold God, surrender, trust Him more, and He will always come through. He will always come through. If you are a believer, welcome to the family. If you're not, think about Jesus, surrender your life to Him, and trust Him to navigate every aspect of your life. There were times when I felt like giving up, and he was my comfort at that period. Like I told you, I had the Holy Spirit. I had angelic presence during my English journey, and even on the English hall. I heard there was an answer. I was confused. I trusted him. I had already prayed and gone in. And when I was looking at it, I was like, what is this one? And I know I heard him clearly choose this option. I was shocked. I looked around. It was only me. And I chose it. And at the end, this is where I am. In my studies, there are some papers that I'll look at, like there's an assignment to do. I don't even know where to start. A simple prayer helped me, and trust me, he always helped. He always comes through. I've never done coding and all of that. And in the informatics, in my informatics classes, I was meant to do like, and it's online. No instructor will come and tell you this and this and that and that. But I trusted God. In fact, there was an assignment. I think that was when I knew I was on the right track. And um, I knew I was struggling with this coding assignment. I had to reach out to the professor. I'm like, hey, can you give me more time? This thing is not working. I've tried Google. I tried AI to help. It was not working. And that night, I know I slept. My mom was around then. I was crying that I would fail this course, and I slept. I was crying. And I slept off crying. In the dream, I saw somebody telling me, no, this is how you do it. It was like my computer was in front of me. And the person told me, now, do this code, do this code. I don't know what the code was. I woke up, I picked up my laptop and I did it, and it worked. And I had an A in that. So hold God, trust God. He's always going to come through. He's going to help you. um don't be like people who live when they come into the US. You just like, after all, we are already here. Maybe we don't need God. Or then there is a system, there's a different thing in the atmosphere here that will make you want to feel like you don't need anybody. You are master of your own and all of that. Hold on to the God that helped you from Nigeria or from wherever, from Zambia, from Saudi Arabia. Hold on to that God that helped you till here. Don't ever let him go. You want to buy a house, he's going to direct you. The hospital you're going to work in, he's going to help you. How to navigate challenges at the workplace, he's going to help you. If you're tired of a place and you want to move, he's going to help you. He is going to come through. You want a higher pay. Something I also faced a second bullying experience. And this time around, I stood up to the director of nursing. The only part I kept, Bursdy, you remember that when she wanted to report me to the board of nursing and I cried. I was on my right, but she felt like, well, you're a black. You can't do anything. I cried. I remember Bursdy and Sir Augustine. Bursdy mentioned then, and he said, you can fight this. If she reports you, you can fight this, but it's going to take a long time. Your license is going to be on hold. But Sir Augustine said, Cynthia, just go ahead and do that job and resign immediately. I resigned, like I wrote that night. I resigned on the spot. And I think it was like the night before 12. And I told my agency, I said, effective from this day, I am canceling. Guess what? When they investigated that matter, they found out that I was right. It was apologies. And it was not just apologies. I came back to the job. I did not just come back to the job. I came back with a $10 increase in my salary. It can only be God. I knew I cried. It was something I was like, God, this is not what I came here to do, to come and beat. I'm running from one, I'm coming to come and beat another one, and all of that. But God knows how he turned lemons into lemonades. So always hold on to God. This is my word for you anytime, any day. Anyone who knows me, I will always tell you, hold on to God. Never leave him. And he will always come true for you.
Thank you so much. Awesome. Thank you so much, Cynthia. So this is where we bring the program to a close. So this program was brought to you by your one and only vendor of good news. And we want to say a very big thank you to our guest. Thank you so much for being here in this program. We really appreciate your presence, and we appreciate the fact that you didn't hold back on any information that was supposed to be given. Thank you. I like those hats. Any information that we're supposed to receive, you gave it all to us, and we want to say thank you. This program lasted for close to 3 hours. I mean, who has done that? We can't even pay you if you are to pay for this your time, but
Oh,
thank you so much. We appreciate you. Thank you.
thank
Thank you. Thank
you.
you. And to all our viewers, keep a date with us next week, Friday. We'll be in this same place and on this same channel, on this same YouTube, wherever you're listening to us. We'll be here. We'll be exposing different areas of your migration journey. We're going to be bringing somebody. I think this guy is from Kenya, but he's been here in the US for a very long time, and then he'll be coming to give us more information about coming to the US and how it felt for him coming from a different country. So keep a date with us on next week Friday, 1 p.m. I think the time is going to change for some of us that is in the US, but for
Yes,
those that is in West
on
Africa,
Sunday.
the time is still going to be the same. All right. Yeah, but the time is
Mhm.
changing for us. So it's going to be our 12 noon that will be having this. But for those in West Africa and other regions, whatever that the time is still going to be the same. All right. So thank you, thank you, thank you, and have a very lovely day. Bye,
Thank
everyone.
you.
Bye,
Bye.
Cynthia. Thanks for coming.
Bye.
Yeah, bye.